So as osteopathic physicians, we believe that we're actually palpating something more than just bones and muscles and ligaments being out of alignment. And that something has to do with what we call the vitality or the health of the patient. And that we're able to actually feel a movement or a rhythm in the fluids of the body, which is where we feel this health lives within the patient. And so that fluid has its origins in the conception of the embryo. And in the first few days of embryonic life, there's a fluid streak that's formed that is the basis for what we call the midline, which is the central nervous system. And that midline has a fluid intelligence, a fluid potency that is basically directing the whole embryologic process. It's before the central nervous system ever appears on the scene. There's some activating, intelligent life force that's present. So in osteopathy, we have a way of feeling this fluid midline because as the embryo develops and turns into a fetus and is born, there's a certain natural rhythm that occurs of this fluid system, kind of like the ebb and flow of the tides of the ocean. In fact, we call this the tidal body because it has such a resemblance to the tides of the ocean. And so we can palpate the different tides, and we can palpate it if there's a problem of some pathologic significance. There'll be a decrease in the vitality of that rhythm, or maybe the ebb won't be as strong as the flow, or the flow is not as strong as the ebb. So when I put my hands on a patient's head, I can immediately pick up on this fluid and tell a lot of things about what's happened to the patient. Many times because of trauma or severe illness, the vitality of this fluid will be very decreased, sometimes not even present at all. In my experience of Keen-Tone, my interest was originally piqued because of the idea that there's a living ocean inside of us, and to be ingesting something that is marine therapy intrigued me. I immediately noticed a particular response in my body where I felt that my perception changed. I kind of felt like everything slowed down in the same way that I experience when I'm getting treated in this osteopathic method. There's something that happens when you stimulate the fluid of the midline using osteopathic treatment that changes the rhythm. So the rhythm is normally about 6 to 12 cycles per minute. An ebb and a flow is one cycle. And when you treat a patient and you create something called a still point, where the rhythm actually stops completely for a little while, something happens, the system reorganizes, and when it comes back, it's significantly slower. Sometimes as slow as 1.5 cycles per minute. And so when I first had my Keen-Tone experience, I felt exactly the same as I do after I'm treated and I have my fluid shift in that same manner. So I had my kids and my wife also take a dose of Keen-Tone. It was the isotonic. And I put my hands on their head to see what I felt. And in every case, I felt this slow rhythm that is something that doesn't happen naturally, except in situations where there's some therapeutic event occurring.